Thank you for joining us today to talk about Ultherapy. We have our special guest Law joining Rachel today to talk about Ultherapy. You got to meet her yesterday if you were here for one of our sit and sips. So some of you have already been to them, know the drill. Please make sure that you chat your name and contact information to be entered into the raffle if you're interested in winning that prize at the end. Also, feel free to ask questions throughout the talk on chat. That way we can answer those questions as we get toward the end of the talk and make sure that we're able to do that. You can do that at any time and we will be sure to get to your questions. So without further ado, here is Law and Rachel.
Hello, everyone. Welcome. Thanks for attending. And if you stick around with us at the end, you have a chance to win a free brow Ultherapy treatment, which is a fabulous treatment. So stick with us and we'll do that at the end. So we'll move on to our next slide and we'll show our special. So our special that we have today is $2,500 for the lower face and neck. You get to add either around the mouth or the brow with a free Dysport and BBL treatment with that.
Oh, I guess I'm working for free.
You are working for free.
Wow. Lower face with neck.
Yes.
Oh, wow. With the neck.
It's a fabulous special. So if you're interested at all, good time to buy. So we'll move right along. So what exactly is Ultherapy? It is the gold standard non-invasive treatment that is FDA cleared for lifting and tightening. So it's a fabulous treatment. What it does, let's talk about aging. I like that.
Oh, this is a beautiful slide. I like this because you take a look at this girl and, they actually just, computerized her aging, right? So let's say I am the first girl and Rachel is that second girl and we don't have that third girl here.
Nice.
But, I tell you, Rachel and I have both done this treatment. And so I'm 34 on Saturday, and I've done this treatment about 2 years ago. So I'm going to look like this for the rest of my life because of Ultherapy. I love this because it takes an overall global approach on the face. And if you're on this Zoom right now and you're thinking, I'm too young, I'm like, no, girl, you ain't too young.
Or if you're thinking you're too old, because there are certain benefits that everybody gets out of it, because it does create collagen and it does it at a very deep level. There's nothing that does what Ultherapy can do. But I will say, if you are somebody that likes to do, I call it the 2-finger facelift. If you like to do the 2-finger facelift, maybe this isn't the right treatment for you. So let's move on. So this is a really cool slide, Law.
This is a beautiful slide. If you look at the first picture here where it has that weakened collagen fibers, right? You're starting to
Talk
see
about
the waves.
hamburger.
Okay. This is, your face is a hamburger. Okay. It's a beautiful hamburger. You got your patty, a nice beef, and you got your lettuce, tomato, and all this good stuff, right? There's a nice hamburger patty. You're like, yes, beautiful skin. Guess what happens as you age? The patty gets soggy. Really soggy. The bun.
Whatever it
I'm
is.
Asian. You're getting the picture, right? Your bun is getting soggy, it's deflating, and you're
Yeah.
like, oh, do I want to eat this hamburger? You're like, no, I really don't. But that's what weekend collagen is. You're losing the foundation, you're losing that nice bounce, and it's hard to build collagen if you're losing it at a rapid rate.
Yeah, and that's what happens. But I love the bottom photo or the bottom part of the
Yeah.
photo slide here. It shows you healthy tissue, and
Happy.
that's what we all want. So this is a really unhealthy and healthy. Okay, we'll move right along. So again,
Why
we're gonna
choose Ultherapy? Why?
well, I'll tell you one reason why. It's 95% patient satisfaction, besides it being gold standard non-surgical
Beautiful.
facelift. I mean,
Mhm. It's a win-win, and no one will know you ever did it. Everyone will always look at you and say, why she looks so good?
So let's talk about one thing. It's called Ultherapy because it's based on
Ultrasound.
ultrasound.
waves.
So let's move to the next slide and see what we've got going there. So here is what Law actually sees when she is treating you.
Ultrasound has been around forever, and they're basically using micro focused ultrasound waves. And I could visualize what I'm looking at when I'm treating you. So if you could look at the screen here, you see that dermis where it says DS right there, and you also see that FM. I'm able to see if I'm treating that 1.5 layer, the epidermis, dermis, and then I'm looking if I'm treating the subcutaneous fat or muscle. So me visualizing what I'm seeing, what I'm treating, it's great.
And she's treating what you need. So let's move to that next slide. This is just another slide that shows you exactly what she sees again and the ultrasound. And let's talk about those layers a little bit more.
So I always look at everybody and I look at that white layer. You see that nice little thick white layer there. I want to see a beautiful layer of white collagen. And I'm going to see that in your first treatment, very small. By the time you come back at 6 months, I could visually see it. And I wish we could like take a Snapchat and picture your collagen and how much it's thickened. But the pictures at your follow up will show.
So we're building that collagen, and nothing can do what Ultherapy can. I just can't say that enough. And this is a great example of how deep Ultherapy goes. And I'll let La talk about that.
So if you look at here on the slide, you see the surgical facelift going all the way down, right? 1.5 all the way to that 4.5 layer. And then we have our lasers that's only going to hit that dermis, right? And radio frequency, I'm very familiar with that. It's doing that bulk heating. And again, it's only going down maybe to that deep dermis, but you have to keep that bulk heating at a certain temperature. But then you look at Ultherapy, you're at that 1.5, 3.0, and then that 4.5 layer at that micro focus ultrasound. And you're basically hitting that dermis, the fat connective tissue, and the muscles. So you're getting contraction of all the layers of the skin.
So we'll move right along. So this is actually a lower face treatment. La and I both kind of talked about the top
That's
photos
me.
are La, the bottom photos are me. And you can kind of appreciate though what different age groups get out of it. Besides, you're always going to get healthy tissue, but it's a great photo of lower faces. Is there anything else you wanted to add there?
Especially for this younger patient here, you're starting to see that jawline. She was losing that she's starting to get the skin laxity, especially the pre-gel sulcus here. And you look at the older patient, very strong, very lax. So when you're starting this treatment, you can't tell me you want this.
No.
You can't. But if we're at that moderate stage where I see a little bit of gelling, you're a good candidate. But
Yeah.
Assessments and consultations.
Yes, but there
must.
are other things we can do for gelling. We have very cool options for gelling, and we have very cool options for fullness in the submental area. So, and sometimes we need to address those too. So we'll move right along. So
Hairline to chest line.
these are areas that we can treat with the FDA cleared non-invasive procedure. And we'll move right along again. So before and afters of brows. The brows are very interesting because Dr. Chang does these all the time in the operating room with an upper lid blepharoplasty. That word usually is not hard for me to say, except when I'm talking to a computer. but it goes really well in conjunction with a lid surgery. But it's a nice procedure for anybody. Also, I think it's a great procedure for a man because it can give a man a little bit of brow lift, and it's not something that they have to maintain on a regular basis like Botox. So it's
Easy.
brows are easy, fabulous procedure to have done. So here we have under the chin.
We have a lot of patients complaining of that gobble neck, right? And there's not a lot of things that you can do besides all therapy and skincare. Firming serum.
Well, we want everyone to be using firming serum. We have to give our little Zeo plug for that. It's very important. Okay, so before and after of Next. Next, again, this is the only FDA cleared procedure for Next. We have lots of options for Next, but we want you to also be using great skincare, great neck cream. I have patients come in every day that are not using anything on their necks.
No.
And I wish somebody would have told me to start when I was 20, 25 years old. So Next, it's the perfect option. Décolletés is a great area to treat if that's one of your things that you are interested in. We'll move right along. So this is one of our own patients. The reason why I like this photo is I think it's a very, it tells you exactly what Ultherapy can do. It is definitely not overwhelming, but you can appreciate the difference in the before and after. The patient was very happy, and it's a natural, nice look, and no one would ever know what she had done. Law.
Again, all therapy, I love it. There's no downtime. You come in, we do your treatment. It takes about 2 hours, right? It's customizable to you. You're going to see your results in 3 to 6 months. And if you're really fine and attuned, you're always going to look at the mirror like, did it work? Is this? It's true.
Let's talk really quick about our one patient that lived out of town, moved to Bakersfield, sought us out because we do Ultherapy. She came in here. She was fabulous looking. She was in her late 60s, and she was having her third Ultherapy treatment. And I could not believe how good she looked. So I hope I can do Ultherapy and look like her until I'm late 60s. Okay, so again, we'll go to our specials. And it is $2,500 for lower face and neck, and you can add either around the mouth or the eyes, and then you get that free Dysport and BBL with it. So it is a fabulous special. So I think we'll move right along to questions if we have any.
We do. So how many times a year is this recommended for someone for healthy skin maintenance?
I would do your first round 1 to 2 times a year because it is included your 2 treatments. And then after that, you could come in every 1.5 or 2 years.
You can do it when
annually.
when you feel like you need to. I mean, that lady that had done it 3 times probably had done it about every 3 years.
Yep.
I mean, it depends on what skincare you're using. It depends on your maintenance that you're doing. It depends on your lifestyle. There's just so many things that go into it.
I have a couple that come in annually. They come in and do it together. That's their treatment.
And that's what they like, yeah.
Will I see results right away after the treatment?
Negative goes right away.
That's a big negative.
Though you will see your results in about 6 months. You will see your results, and I say 6 months. And you have to not just do Ultherapy. You have to take care of the skin. You have to wear sunblock. You have to.
Yes, 95% of your aging comes from the sun.
How long will the results with Ultherapy last?
These results, if you do 1 treatment, they can last up to 2 years.
And I still say everyone's a little different.
Everyone's a little different.
Depending on lifestyle, depending on how you maintain it, how you take care of things.
Age, genetics, I cannot fight that. But again, if you're going to take care of your skin, you're going to do this treatment. And you do it with other treatments that we offer here because like Botox, right?
Well, fillers. You don't age in one way, so we can't anti-age in one way.
So
we did get a question about how many vials is needed.
Vials, it's not Botox or a filler. It's a laser. So
So it's a treatment.
It's a treatment.
So it's a procedure. So you actually come in and have a procedure done. We do not inject anything into your face when you have it done. They are actually heating up the different layers and performing a procedure.
Does the MAB special include 2 treatments?
Yes. Yes, it does. That means me working for free twice. Just kidding. I mean, come on, you're getting. I thought it was just the lower face, but it said and neck, and then I do this, and then I add this, and then you do your talks, and then BBL.
Pretty good. You're ready for the next wedding.
You're fine. You're good. You'll be COVID delicious.
Is there anything you need to do to prep your skin before?
Negative. It's non-invasive. It's colorblind.
You know, I have a friend, and I'll just tell this story really quick. I have a good friend who will not stay out of the sun, who does not use good skincare. And this is the one treatment that she was technically only eligible for because she couldn't do a laser. She couldn't do anything else. So she did Ultherapy. She actually was a little underwhelmed by her procedure, and I kept kind of asking her how she felt about it and did she love it. And finally I stopped asking her, and 2 years later she asked me if she could schedule her next Ultherapy. So I think you do notice the improvement.
It really stops your aging when you do it.
It does.
It stops it. And then you do one, and then you do one again in 6 months. You could pretty much expect the longevity of your treatment's even going to last longer.
Are there any ZO products that are recommended to use after the treatment?
All of them.
I would say you're asking the wrong girl.
Firming serum and growth factor.
Yeah, you need to be using those great neck treatments. I mean, I'm getting my jowling and I'm fighting it. I'm getting that under chin area. I'm fighting it with all the treatments that we do, but I have to be doing my part and doing my firming serum and doing my neck creams because we can't fix everything.
What are the post-procedure guidelines regarding exercise and sun exposure after this treatment?
Stay away from the sun forever. Just kidding. No. There's no downtime. You could go out in the sun as long as you wear sunblock. You might have a little red dots. It goes away within.
You can have some redness, possibly some bruising, but nothing
major
to keep you down.
No.
Really, it's a simple procedure.
One of the other questions was, are there any side effects after the procedure, whether temporary or permanent?
Permanent. You look delicious. You look good. Side effects? You should have done this sooner.
There's always risks and benefits with every procedure, but we'll talk to you about those when you come in. But it is a serious procedure, and we want to treat it that way.
And we do mark your face. I say this jokingly, but we do have a mental nerve here, and we do avoid that. We have the intraorbital nerve here, and I do avoid that area. So this is why it's done by a medical provider.
This is why you want a good provider to do your treatment and somebody that knows what they're doing.
Is there any pain during the procedure, and what is expected during the procedure?
So, well, what is pain? Just kidding. So Tylenol, Motrin, those are your best friends. We do have Nitronox, laughing gas, right? And we do give you some numbing cream. And I'll tell you, come in, get the numbing cream, go home, apply it, come back, let's make some magic. And
the Nitronox can help a lot. It's not a pain-free procedure, but it is worth it. And we do everything we can short of anesthesia. Now you can purchase anesthesia to do it if that's what you want to do. If you want to do a full face neck and décolleté and you want to get anesthesia to do it, you can. But it is bearable, and the Nitronox does help a lot, which we've really only been doing that a couple years now, but it is a great add-on.
It looks like that's all the questions we have for today.
Okay.
Raffle tickets.
Yes.
We've got the raffle.
Ready for this? That we have 15 raffle baskets.
Yeah.
And that's over $45,000 of goodies that we are giving away when you buy a raffle ticket.
Yeah, and we are donating all of the money from the
To
raffle to the Valley
Valley
Fever
Fever.
Institute.
Yep. And that, with valley fever, it's very prominent in our community. I know my parents both have had valley fever, and it's an unfortunate disease. And we live in this dust bowl, and
Yeah.
we need money, we need funding, we need research. And that's why we love doing this annual event, because we always like to support our nonprofit organizations, and it helps the entire community just flourish.
Yes, so buy your raffle tickets.
And you could win more.
Yeah.
We have one last great question that popped in at the buzzer. And if someone's already coming in for some treatments, when could they do this procedure?
When do you have 2 hours to give me? 2 hours. And it's hard because we have to block these 2 hour gaps. And I know my Friday afternoons is when the patients want to come in. So those are being filled up fast. So I'll be like, hey, girl, call. 2 hours, book me, stat.
We might not want to do it the same time that you've just done a profractional laser or something like that. But for the most part, you can do it in conjunction with all of our treatments here.
One last great question as well. So if you've had filler, can you do this procedure?
Yes, they've done clinical studies where it does not break down your filler. So you'll be extra delicious.
Mm-hmm.
And we've got one last one. I heard somewhere that if you have Sculptra and Ultherapy, they work well together.
Everything works well together.
Absolutely. Because I think the Ultherapy goes even deeper than the Sculptra can. But again, we're losing that collagen. That is aging, is losing that collagen. And both of those are helping replace that collagen loss. They work fabulous together. I've got both of them.
I've done it.
Okay, she has a winner, Law.
Bum, ba-da-dum. Lacey Walrath.
Yes. Lacey, congratulations. You get a brow Ultherapy treatment, and I am jealous. We will be contacting you for your how to pick up your winning ticket. Okay, thanks everyone. Thanks for attending. Goodbye.